Good morning, everyone, and welcome to our second town hall in quick succession for the new academic year. I'm Claude Brûlé, and I'm the president and your MC for this morning. As a guest on the unceded and unsurrendered territory of the Algonquin and Anishinaabe people, I'm honored to offer an opening. We do these opening and thanks in this fashion as the words that are spoken before all else when we start important gatherings and events such as this one. And so I want to give our thanks to our grandfathers and grandmothers of yesterday, today, and tomorrow for keeping and sharing their knowledge. I want to give thanks to the spirits of the wind, fire, water, and earth, and give thanks to the spirit of the north, the east, the south, and the west, so that we may live our lives in a good way, and for us to be together today with a good mind. Miigwech. I would like to introduce our panel members for this morning's town hall. Mark Savinkoff, VP Advancement, Chris Jensen, Senior Vice President Academic, Diane McCutcheon, Vice President Human Resources, Dwayne McNair, Vice President Finance and Administration, Laura Stenbra, Vice President Student Services, Ron McClester, Vice President Truth, Reconciliation, and Indigenization, and new to the panel, Ben Birchstock, Director of Student Support Services, and a regular on our town hall, Colin Benang, Director of Risk Management. Some housekeeping rules, I guess, or details before we get started. If you have any technical questions or concerns, please reach out through the chat box and our events team will be able to assist you. We have closed caption again available, and you can use it by clicking on closed caption button on the main bar in Zoom. You can ask a question on the town hall by raising your hand, and you will be selected to ask your question live. And then you will need to unmute yourself, and you'll be able to chat with the panel. Alternatively, you can use the Q&A chat box function. You can type in your question, and then I will read it out and then direct one of our subject matter experts to answer it. If time is limited and we can't get through all the questions, we will take away the remaining question in the Q&A, and we'll endeavor to get answers to them and post that on my AC in the days that follows. If you're watching this town hall through the live stream link on YouTube, please submit your question in the chat on YouTube. They will get sent to me by our events team, and I'll address those questions in that fashion. So this morning's agenda, it's really a one-topic agenda. We said that this is not our normal town hall format, so we did not have a musician this morning. We don't have pre-submitted questions. We really want to use this time, as listed here, to go over our vaccination policy highlights, its implementation, the app that was the module of the app that was developed, and the decision tree associated with it. We're going to talk about some HR components, health services components, and student processes that are tied to the policy, and then we'll go to questions. So a couple of presentations first to set the tone and maybe answer questions you may already have. And I have to say, a lot of that information is already contained on our website in our FAQs. So hopefully you've had a chance to read some of this. It may address many of the questions you might have otherwise. So without further ado, I will turn it over to Colin to get us started.
Thank you, Claude. Good morning, everyone. I'm going to start by just speaking about our COVID-19 vaccination policy, where we've come from recently and where we're at with our policy. Next slide, please, Bonnie. So to give this some context, this has been a highly iterative and very much compressed process. I've been with the college 21-ish years now, and I don't think I've ever seen something move so quickly, something that is so complex, move so quickly across not only our college, but the entire college and post-secondary system in Ontario. We started looking at this August 5th, when we were apprised of an Ottawa Public Health recommendation that impacted post-secondaries in Ottawa. The next week, a great deal of time was spent gathering some clarification around that to understand the nature of it. Certainly, we've always maintained that we are in a position to be following Ottawa Public Health recommendations throughout the pandemic. And we started to turn our minds to what a policy might look like around mandatory vaccination. That was quickly escalated August 17th. Many of you may remember the Chief Medical Officer of Health for the province included post-secondary in his recommendations. And at the same time, you may recall we were expecting that we might come out of step 3 August 6th and did not hear anything until the 17th, which is when the Chief Medical Officer of Health suspended step 3 or paused step 3, suspended the exit, but paused step 3 and kept everyone within the step 3 requirements. There was a great deal of communication back and forth between Algonquin and certainly all the colleges, Colleges Ontario, the Ministry of Colleges and Universities. And in gathering that information, we began to use it on a daily basis sometimes to inform how we were drafting our policy and what we would need in terms of a technology platform to be able to support that policy. So there was a lot of changes going back and forth during that period. On August 18th, you'll recall that the President made his announcement that we were pursuing a policy. And Bonnie, if I could have the next slide. And then we continued to work through this. August 24th, there were further recommendations that were made that the college needed to incorporate into the development of our policy. And finally, some regulatory changes. And the regulatory changes really concreted the requirement for the college to respond to these recommendations with the weight of legislation requiring the college to comply. We were targeting certainly September 1st for the release of the app, and we sent out a message on the 30th to indicate that the draft policy had been released, and it wasn't until the 31st this week that we received additional documentation from the Ministry of Colleges and Universities in terms of a framework document. And the framework really takes the body of public health recommendations that are now reinforced through legislation and identifies or structures it in a way that the colleges can use as a guideline for implementation. So we are still reviewing that document and making sure that all of our policies and processes and procedures still conform to the ministry's expectations. By and large, many of the things we've done to date and all of our policies that are in place and our practices do. And there's a few areas within that framework that we need to continue to visit. September 1st, yesterday, we had a very successful launch of the app. I can say thank you to everyone who has participated in using the app. We have over 3,000 college community members who've already submitted information into the app. Also, yesterday we heard that the Premier of Ontario is announcing a vaccine certificate program for Ontario. So recent information is that by the time that vaccine certificate program gets up and running into October, that it's still relevant and still important that the college and all colleges and universities in Ontario proceed with their plans for mandatory vaccination policies. Given the timing, it's not something that we would be waiting until late October to be part of the provincial system. It is important, according to public health, that we start in with our policies now as we have planned. Next slide, please, Bonnie. So the policy responds to those public health requirements, complies with the legislation. The overarching certainly intent of the policy, as all of our policies have been, is to ensure the safety and well-being of the college community. And with this, we want to promote education and awareness regarding vaccination. Certainly, Ottawa Public Health's concerns are that we make sure that we can continue to drive awareness around vaccination. There is still a rather substantial percentage of one of our primary demographics, the 18 to 29 demographic, that remains not fully vaccinated, probably about 35%. And certainly Ottawa Public Health is concerned with those numbers, given that we have a campus operation where people will mix. It's important for us to continue to help drive those messages. Our policy is effective immediately. And I would like to stress that it really only applies to college community members who are attending in-person activities on campuses. If you're not attending campus, or there are no firm plans for you to attend campus, then it is important that you not use the app. The college does not need to gather that information from you. And certainly right now, especially with the applications that are being submitted for those people who are coming to campus in the very near future, if we're approving unnecessary vaccination passports, it really just takes that time away from the work that needs to be done for people who are coming to campus. So if you're not coming to campus, please do not use the app. By September 7th, full vaccination, the requirement is that people be able to demonstrate proof of vaccination by September 7th. And after October 12th, we've used this window to allow for people to get up to speed with their vaccination efforts. Next slide, please, Bonnie. So essentially how the app works, again, if you're not intending to attend campuses or in-person activities, the policy does not apply in terms of the requirement to upload vaccine information. If you are attending, really you fit into one of four categories. You are fully vaccinated, you're partially vaccinated, you may have a medical or other human rights exemption, or you are unvaccinated by choice. All four of those categories can be entered into the app to provide that information. If you're fully vaccinated, you'll simply receive an email back thanking you for being fully vaccinated. The partially vaccinated email that people will receive back really is a reminder for them to continue to pursue their vaccination, and a reminder in terms of what happens with the policy that after October 12th, their passport would expire if they have not updated their information to full vaccination. Medical and human rights exemptions will receive an email confirming that their information has been received. And in those cases, the name and email address of the individual who has made that attestation is forwarded to Student Services or Human Resources for those areas to engage in a discussion with the individual to determine the bona fide nature of the exemption that has been claimed. Unvaccinated by choice is the fourth category. And those folks, if you make that selection, again, you'll receive an email. It has a great deal of information in it surrounding awareness and information and reminders around the policy. And it makes note that if you continue to remain unvaccinated by choice, that access to the college may be denied after October 12th. Next slide, please, Bunny. How the app works, we've taken an example for a fully vaccinated person and just done a step-by-step. This is also on the website and in the communique that came out under my name earlier this week. We've provided links to this full step-by-step process, but essentially very simple, using the COVID-19 button. As you go into the app, you'll see two buttons, one for self-screening and one for vaccine passport. We are still required to do self-screening. So now there are two features on this that people coming to campus should be familiar with. Identifying your status as an employee, student, contractor, or visitor, and then signing in with your college credentials. When you begin your passport application, next slide, please. You'll have a screen that looks like this, where you will apply for your vaccine passport based on those categories. fully vaccinated, partially vaccinated, no vaccination. The subsequent screen for no vaccination then breaks down into, is it because you are making an attestation around an exemption for medical or other human rights reasons, or is it because you remain unvaccinated by choice? And then entering your vaccine information. There are pick lists to help you enter your vaccine information. It is important to know when your doses were before you start this, because it asks for your date for your first dose and the type of dose you received. And then using the third field, you simply upload a picture. If you're using a phone, from your photo gallery. If you're using a computer, you can use screenshots or upload JPEGs, PNG files, whatever you might have. And you do that for each dose of the vaccine. And essentially, that's it. You hit submit, and the vaccine app is completed. I think end to end, when you have all your documents available, takes less than a couple minutes. Next slide, please. As I mentioned, what you'll receive when your application is submitted is an automatic email that says it's in review, and it is necessary for us to look at those uploaded documents to confirm that they're valid. And then once it's approved, within 3 days, we've put in the policy that we do need some time to get through the numbers that are coming in. But within 3 days, you should receive an email that says the review has been completed and it's been approved. Or you'll receive an email indicating requirements for testing based on an unvaccinated status. Other than that, if you have identified an attestation for exemption, your next communications would come from Human Resources or from Student Support Services. After October 12th, we've identified that rapid antigen testing is not an alternative. Really, the public health objectives with this, and from a recent information from the Chief Medical Officer of Health for the province of Ontario, has identified that rapid antigen testing is not preventative. It's a measure that can be taken to help assure safety as we move through this, but the goal of this is really achieving the highest rates of vaccination possible. So our policy supports that after October 12th, if you're unvaccinated by choice, rapid antigen testing is not an option. Certainly, if you have medical or other human rights grounds and rapid antigen testing is required, that can continue on beyond October 12th. I think that's all we have. Next slide, please. Yes.
That's it. Thank you very much, Colin. Great explanation, and I'm sure we'll have a few questions on this. Diane, we'll turn it over to you for human resources scenarios.
Thank you. And thank you, Claude, and thank you, Colin, for that segue. So before we go to the next slide, again, I just want to put this into context. So we've gone through the app process. That is the process for, again, those attending on site to the different campuses and or satellite locations. And so that process triggers the next process from a human resources perspective. Certainly when it's triggering to human resources, it's that list that Colin spoke about. It's a secure list that then comes from his area to human resources with only a name and an email of those individuals that have identified through the app that they either have a medical or bona fide human rights exemption, or they're asking for an exemption for unvaccinated by choice. So those are the triggers that then come to human resources only. We would only get employees. Ben will be talking about the student support services process, and he would only get learners. So I just want to make sure that we're really clear. It is going to be in a secure process, name and email only. And then within our area, we follow up. So if we move to the next slide, I'll start walking through a few scenarios. So the first scenario that we have for clarity is that process comes to us. The employee advises that they will participate in all the required safety protocols as determined both by policy, government directive, Ministry of Health, local public health orders, and all are applicable. Of course, the employee must complete the attestation for exemption through that mobile safety app, which Colin has walked us through. That then triggers that list coming to human resources. It comes directly into our wellness and abilities team. Our wellness and abilities team will then trigger an immediate, as soon as possible, outreach to the employee with an exemption form based on the attestation. So if the attestation is for medical reasons, it's a form to start to collect information so that an accommodation can be implemented and can be made arrangements. In this particular scenario, the employee has agreed to adhere to all safety protocols, and then the accommodation would be put in place, and the employee who is assigned to work on campus would continue then to work on site with the appropriate accommodations in place. If we move to the next slide and the next scenario, we now have a scenario that contemplates, again, this is a bona fide medical accommodation or a protected ground, a human rights protected ground. So we're still in the accommodation process. However, in this scenario, the employee advises that they will not participate in any of the safety protocols required by all of the same agencies in order to be able to be on site. So they do have a bona fide medical accommodation or protected ground, however, will not participate in any of the other safety protocols. So in essence, the employee has declined the accommodation to work on site to enable them to be on campus, but requires them to participate in any safety protocols. That is declined. What we then will do is engage in a temporary vacant position process and commence search for a temporary vacancy option that they are qualified for or where work can be performed remotely. If that fails, the employee will transition to an unpaid leave of absence. Next scenario, please. So in this scenario, again, this is through the bona fide medical accommodation or protected ground accommodation. The employee advises that they will not participate in any of the safety protocols, again, as per all of those agencies. There is no temporary vacant position that we've been able to secure, that we've actively looked for with our wellness and abilities and the employee and manager, and through that whole process. That is a normal process. It then goes immediately to unpaid leave of absence. If we move to the next slide. So what I had just covered was the processes that we are outlining for a bona fide medical accommodation, or again, protected ground. This is a different path that we're now walking through different scenarios on. If it's an unvaccinated by choice, a personal arrangement. It is not called an accommodation process. It is called, we are calling it an arrangement process because it is not a bona fide medical accommodation requirement. We go to the next slide. So in this scenario, the employee has advised through the app process that they've chosen not to be vaccinated, but do agree to participate in all the safety protocols that Colin has walked through and we have in our policy. The employee will be able to continue to work on campus until October 12th. And again, this is for positions that are required to be on site. They have been deemed essential to be on site. Employees must then adhere to all the safety protocols in place, and as per that article in the slide. Move to the next slide, please. For this scenario, again, this is for unvaccinated by personal choice. The employee advises that they will not participate in the safety protocols. So then what happens? Well, the college will, in good faith, engage in a temporary vacant position process and examine if there is an opportunity to place the individual in a temporary vacancy that they may be qualified for and where the job can be performed remotely. We will make our best effort. If that fails, the employee transitions to an unpaid leave of absence. There is a cap to this search for temporary vacant positions, and that cap will not exceed October 12th. Next slide, please. For scenario 3, again, this is personal arrangement. The employee advises they will not be vaccinated. They will not participate in any safety protocols. And the search for a temporary vacancy or an opportunity for the individual has not been secured, or it's past October 12th. So what is our option? Our option is we are placing the employee on an unpaid leave of absence, and the leave will be no greater than the period in which public health recommends the mandatory vaccinations or until the conditions cease. I believe that's the end of my slides. Yes, it is.
Yes, it
With
is.
that,
Thank you for.
I will turn it over to Ben. Thank you.
Great. Thank you very much, Diane. Good to explain all those various permutations and scenarios. We'll turn it over to Ben regarding health services update.
Thank you, Claude. Good morning, everybody. Next slide, please. So it's been a busy week in student support services this week, and one of the things we've been working on is preparing for a rapid antigen testing clinic. Best practice indicates that we would hold a rapid antigen testing clinic separate from our vaccination clinic. So this week we've been working on preparing for both of those to open as soon as possible. Ideally, both will be positioned close to health services just for ease of practicalities, but also for the vaccination clinic, it's essential that that's close to the health services in case there's any medical reactions and the physicians are required to assist. We have looked at starting both next week. We received, I believe, our first doses of Moderna that we can start sharing next week, and you can book appointments now for students or employees. And I think communication went out yesterday from the communications team to that effect. We also are expecting the rapid antigen testing kits today, hopefully, and are preparing to start that process early next week. We will keep people informed and make an official announcement when that clinic is ready to go. Next slide, please. We anticipate using the collaborative space room in C building for a vaccination clinic right next to, just in the lobby of C building next to health services, and the testing will be in that general vicinity as well. I think I've already covered the other slides there. We're hiring some new nurses who should be starting any day, and they'll be helping us with this transition to these two clinics. Next slide, please. If we can go to the next slide. So in terms of we've looked at the employee process for going through the mobile safety app and submitting your proof of vaccination or your request for exemption, etc. There'll be a similar process for students. They're also invited to go through the app and to submit their information, their medical information or their personal information around requesting an exemption. That process has started already. Once a student has provided the documentation that is required, that request will either be approved or not, and they will be notified through the app. What we have suggested is that students that are not vaccinated or are unwilling to be vaccinated and follow the safety precautions, that they will be referred virtually to counselling services, and they can discuss the implications of their choice and what that might mean for their program and their experience at the college, in a similar way that we do with students that want to withdraw from the college through the Interceptor program. Student support services will collect data, which will feed back to the college to inform them of the trends and the patterns that we're seeing here. And we'll work closely with Colin Benang's team to make students are notified in a timely fashion about their status once they've submitted their documentation. The AC Hub will work with our communications team at the college to make sure there's messaging going out to students. And I believe there'll be messaging inserted into a lot of the AC Day 1 activities and websites for next week, just to reinforce the messaging again. If there are any appeals to the decisions that are made in this process, those appeals will be handled by the Ombudsman's Office, and they'll have oversight on those most challenging of cases. Next slide, please. This slide's a little bit difficult to read as we go from left to right, but it just gives us a breakdown of how the process will unfold for those in different categories. And I'm not going to try and read it out, but we do have a process, and we'll be continually refining that as we go. And we already have a number of student requests for exemption that have been submitted yesterday, and we anticipate there'll be some more in the coming days, and we'll work through those on a case-by-case basis. Next slide, please. Thank you for your time, everybody.
All right, thank you very much, Ben. I believe our next piece is now going to questions and answers. So again, you can ask your questions in a multiple fashion. You can raise your hand using the raise hand feature at the bottom of the Zoom bar, and I will identify you. You will need to unmute in order to ask your question and then converse with the panelists. And other fashion is to click on the Q&A button again in the Zoom bar and type in your question, and we'll proceed with those in the right order. And I'll turn it over to a panelist to answer your question. And if you're watching from the YouTube channel, you can use the Q&A feature on the YouTube channel, and the events team will relay your question to me. And finally, again, if we can't get through all the questions in the time that we have about just shy of an hour, but if we can't get through all the questions, we will take up those questions afterward, answer them, and then post them on my AC. Before I go to questions, though, there's a couple of points I want to make, and I see, Leslie, you've got your hand up, so bear with me for a sec here. I've got 3 points I want to make. You will have probably seen through the media recent announcement from the Chief Medical Officer of Ontario, Dr. Moore, amending the Ontario Regulation 364-20, eliminating capacity limit and physical distancing specifically for post-secondary institutions for indoor instructional settings. And that may have causes you to have a deer in the headlight look and go, what? Let me explain that our plans at Algonquin College and our position remains the same. Our academic plans, our plans for service delivery have been put in place since July. We have recruited our students on that basis, and they have made decisions to relocate or not relocate, depending on what they knew our service and academic delivery was going to be. So receiving such an announcement at this late stage is tantamount to pulling the rug under everyone's feet. And we're simply not going to do that. We are staying the course with the arrangements that we have made. Now, there may be opportunities as the semester unfolds to loosen perhaps some of the restrictions we have in place. For example, capacity in our library, as an example. So we are going to be looking at that, but at the moment, the plans that we have put in place continue. I have conversed with my colleagues in Ottawa at the Youll, Carleton, and La Cité, and we're all of the same mind, and we are all carrying on with the plans as we have set them. The statements as well state that local public health unit requirements may be layered on top of these amendments or override some of these loosened restrictions. And I've got an appointment with Dr. Vera Etches to talk about that specifically for our situation. If there are any changes or any things we need to amend, I'll be conveying that to our team so that we can reflect this in our policies and our procedures going forward. Next point I want to make is that it's not anyone's job other than those we have specifically tasked to police and enforce this policy. If you're teaching, if you're providing a service on campus to a learner, to a client, if they're on campus, they've been vetted. So you don't need to ask them, hey, are you vaccinated? Hey, have you been tested? We take care of this at the entrances, and you carry on with your duties. Last point I will make is I will strongly continue to encourage anyone who by choice has yet to begin the vaccination regimen against COVID-19 to take the necessary step to get vaccinated. You will do yourself a benefit to protect your health, that of your loved one, and our community at large. So thank you. Those are my 3 points, and then we'll begin the Q&A. Leslie, you have the microphone.
Morning, thanks, Claude. My question is a two-parter for health services. So first is, if anyone's doing the rapid testing, who's paying for that? And then I may have missed it on the slide, but the other part is, for anyone registering with health services for vaccination or anything else, how is that impacting their registration with their own GP? Because that would be rostering with health services at Algonquin, which can have an impact. So just so people are aware, if they're registering with Algonquin, it may affect whether or not their GP keeps them. So how is that being handled? So cost, and is Algonquin rostering patients? Those are the questions. Thanks.
Okay, thank you, Leslie. Let me cover the first one. We talked about this yesterday. We had an all admin meeting, by the way, just to prepare administrators for this. And a question did come up. And my position is that the rapid testing that will be offered by health services will be for those who are unvaccinated for bona fide reasons, period. So if you are unvaccinated for reason other than bona fide reason, you will need to get your tests done elsewhere. And whether it's free or at cost, that'll be the person's responsibility to see to that. But that is our position on that. For the second part of your question, I'll turn it over to Ben.
Thank you, Claude. Great question, Leslie. Yeah, we certainly wouldn't want people to register with health services and put their own pre-existing registration in a different health clinic at risk. We would advise people to look at their own existing doctors first, because they can help often with the testing and also with vaccinations or recommendations around where to get vaccinated. There's no shortage of options for vaccination or testing in the community. But if somebody doesn't have an existing physician that they're attached to or registered with, we certainly would welcome them to health services. And that applies to many of our students that have come to Ottawa for the first time, or our international students, etc. Those students particularly are welcome at the clinic here on campus.
Okay, and sorry, Laura, you've got your hand up as well.
Thanks. Yeah, thanks for that, Ben. And I do want to note that Trina Budd, our manager of health services, did just put in the chat, typically receiving a COVID-19 vaccine at somewhere else other than your GP will not affect your relationship with your doctor if you are a rostered patient. So that's typically, but also Ben's comments certainly still apply. Thank you.
Okay, thank you, Ben and Laura. Leslie, does that answer your questions?
Yes, it does. Thanks.
Okay, thank you, Leslie. Okay, now we have a number of questions in the Q&A, and I'm also getting a couple questions in the chat that are coming in from the YouTube channel. So I'll try to do justice to both here, although, you know, the order and the timing when the questions were put, I'll do my best in terms of keeping with the order here. All right, so let's go to the first question in our Q&A. For those with an exception, what is the process for submitting COVID test results? So that's fairly clear. Maybe Colin.
Thank you, Claude. Yeah, so if you have COVID test results, there is no process through the app to submit those. There are different types of tests that you can have, and it's not a one-time testing that would generate a vaccine passport. So we do have a manual process set up at the entrances. You can show your printout that shows that you have had 2 rapid antigen tests in the past 7 days. before gaining access to the campus. So it's very much a manual process, but certainly we're equipped to be able to receive those at the entrances. You retain the document. There's no submission of document. It's just a show and go, if you will.
Okay, thank you, Colin. Our next question is a rather simple one. Is it possible for the attendees to get a copy of the slides? So I don't see any reason why we can't. We'll put that as part of our answering questions that we can't get through at the town hall, and we'll make sure we post those. Okay, next question here is from Martin Lee. And by the way, again, great job yesterday, Martin, as MC for our AC Vision event. That was awesome. Martin asks, will the college be providing online/alternative assignments for faculty, I guess that's workloads, for faculty who have opted out of the vaccine, either for personal choice or religious medical reasoning, i.e. will the college ensure that those people will continue to work without access to the college premises? So it's a HR academic. So Chris and Diane, if you want to take a crack at this.
Well, I'm happy to start and to have Diane reinforce this, but Martin, I believe the question you entered came in before Diane's presentation during the bit. Academic employees are employees of the college, and they'll follow the same rules. And I don't know if Diane wishes to add anything to that.
Thanks, Chris. I was actually just going to refer to the same thing that I believe, Martin, this question came in before I walked through the different scenarios. The scenarios are applicable for all the employees. If you would like clarity on any of these scenarios, would you mind just asking for that clarity in another question to the panel, as I'm not sure if you needed me to go over all the scenarios again, or if the clarity has already been provided. So.
Okay, all right, so we'll wait to see if, Martin, if your question has been addressed. You can choose to ask your question live or later in the Q&A. I'll go to a YouTube question that I received. Who is processing the passport verifications? Is it a college employee or a third party? Colin.
The passport verifications are all done by college employees on my team. And that processing, just so people are aware, is very short and simple. It is a review of the documents to make sure that they meet the requirements and an approval. And as soon as the approval is made, those documents are permanently deleted from the server that they're held on. So we really do not hang on to those documents at all. And then from that point forward, the only reference we have is the typical information that the college as an employer and as a college would have for students and staff, which is names and email addresses that are then tagged with a status. But the documentation is not retained at all.
Okay, thank you, Colin. Question from the Q&A from Wahab Al-Mutadi. For the app, what about uploading a PDF as an approval for vaccination? Yeah, go ahead, Colin.
I'll jump right in, Claude. The app is designed to receive picture files, PNG, JPEGs, screenshots, screen clips. It wasn't designed to receive PDFs. We have had a couple inquiries about that, and we have fed that back to the app developer. Perhaps in a new iteration of the app, they might expand that capability. But I would say if you have a PDF, by all means, you should be able to screenshot it or screen clip it and use that for your upload.
Okay, thank you, Colin. Go to a YouTube question. There was a lot of talk about the app to submit the vaccine receipts. What's happening with the website as an alternative? Colin?
Yeah, the website, and we published the link for the website in my communication, and I think we have links for it through the FAQs and also on our website. So the website is up and running. We did hear yesterday in another venue that some folks had a challenge logging into it. And we are exploring that with the app developer right now to understand what that might be. But we've had a lot of other reports back from folks that they've had no problems. So we have to chase that one down. But that web link is available, and we can put that in the chat line.
Okay, thank you very much. I'll take one more Q&A question before I go to the next person that has their hand up. Will the college justify? How will the college justify only testing on vaccinated employees and students when vaccinated individual can still get and transmit COVID? If testing is being implemented, it should apply to everyone regardless of vaccination status, as both are at the same risk of being asymptomatic carriers and spreaders of COVID. I'm not an immunologist or virologist. I won't attempt to answer that question. Perhaps that's a question we can put to our local public health unit. I will ask Colin if he has a further comment to make on this, but to me, this is something we'll take under advisement at this point.
Thanks, Claude. And I think, in terms of justifying our approach to this, we are following the specific recommendations of the Provincial Medical Officer of Health, the public health units, the legislated requirements in terms of what we're undertaking for testing. We do need to trust in our public health agencies that these recommendations are sound. And while it's true that yes, people can get and transmit COVID, and even if they are vaccinated, it is also true that the risk of becoming infected is greatly reduced when you're vaccinated, and the risk of transmission is also greatly reduced among vaccinated people. So we do know those factors, but in terms of the actual regimen around who is tested and why, certainly is driven by the public health recommendations that we're following.
Okay, thank you, Colin. We'll go to a live question. Sean Pentecost, you put your hand up. The mic is yours.
Thank you, Claude. So my question really has to do with basically all the scenarios you've mentioned, right? We could have people after October 12th. We could have people who are working remotely for human rights or medical reasons. We could have people on leaves because they've chosen not to be vaccinated. We're going to have people who are normally on leave anyway for a multitude of reasons and so on and so forth. So I just wonder how the college, and given the fact that this is still a very sensitive topic to people and that people still have a lot of anxiety around this, how is the college going to handle people's privacy and awareness, like, I guess, what kind of public information is the college going to be putting out to protect people's privacy? So for instance, you could have someone who's on leave of absence for a multitude of reasons, but because of the situation we're in, people are going to think, oh, they didn't get vaccinated, and someone shouldn't have to reveal that they're vaccinated to their colleague because their colleague's nervous. Do you know what I mean? Like, how are we going to do those personal things? Yeah,
and that's absolutely true. And people do not need to know the reason why their colleague are not at work for a day, for a week, for a month. Not their business. And for the person who's on said leave or away, you don't have to divulge that either. This is, again, your privacy is important to us. It should be important to you as well. And this, what's the saying that Aaron always says? If it's not on your business card, you don't need to know it. I'm a firm believer in that. So we will have clear statements regarding privacy concerns that we're developing just to ensure that component is addressed. We've been clear in our communication, both verbally so far in the town halls and conversations that we've had. And we want to continue to make sure that irrespective of the reason, whether it's related to COVID or other reasons that someone has had an accommodation or an arrangement through HR, that those are respected and kept private. Diane, did you want to add to this?
No, I think you've answered it very well. Sean, you bring up a great point about, because that's the nature of people working with other people. And I think if we treat each other respectfully and recognize that everyone has a right to privacy, and what is the right to ensure that people who are coming on campus are safe to come on campus. There's a lot to balance there, but we need to be respectful of each other. And as you say, there's a lot of reasons, multiple reasons why a person may be off, and not to please give each other the benefit of the doubt and try to keep that at the forefront. This is an anxious time. So I think your point is very well made, and one that I'm sure resonates with all of us on the town hall, to say, let's be kind to each other as we go through this transitionary fall semester, and that we're working through these issues all together. So thank you very much for raising that, Sean, and we will endeavor to be as clear as possible in our statements that we want to make sure that we protect the privacy of individuals. So I appreciate your comment.
Sean, does that answer your question?
Yes, it does. Thank you. I just, again, I think that reminder every once in a while publicly is very important. Thank you.
Absolutely. Thank you, Sean. I'll go to a Q&A question. Elena, Marian, I read in the policy that placement students who are at host location will follow the guidelines of the host employer. Should those placement students still update their vaccination status on the app? Employers may ask us for proof of students' vax status, as they do for others, like police record checks. All right, so that's for student play. Oh, Colin, all right.
Perhaps I could just start with that one, and then the other piece of that, perhaps Chris may want to chime in on. Yeah, the policy does state that we are sensitive to the fact that our policy reach applies to our operations, our campuses, and our in-person activities for employees and students. It is difficult to apply policy reach beyond that scope, and our placement hosts, those employers are responsible for health and safety in their environments. So it's important that we draw those distinctions. Employers indeed do ask us for proof of student vaccination status as part of our student placement programs. And we have had discussions with many of our areas. This is something that is being absorbed within their practices where those requests are being made. But there is no requirement for the student to upload their proof of vax status to our app, which only applies for our campuses. So if a student is a placement student who never needs to come to campus, they're just following whatever the requirements are for their program and their placement host. If, however, they do need to come to campus at some point, they will need to use our app to provide their vaccine status. Chris?
And just to follow up on that a little bit, particularly the health and allied health placements, the clinical placements are challenging. I was having a conversation with Jane Tracklow about this very topic, and it appears that all of the hospitals are requiring placement students, requiring the college to deal with the vetting of the vaccination status and testing status of those students. It's clearly a fluid situation, and we are trying to sort out how to work with our partners to make sure that they're getting what they need as we are supporting our students through the process. So Colin's right. If they're not coming to any of our Algonquin physical campuses, they don't need to fill it out, work with the app. But there's the additional complicating factor of then how do we support our placement partners? And I don't know that we have a complete answer to that, but Jane Tracklow and her team are on it and working very closely with Colin to get this sorted as quickly as we possibly can.
Okay, thank you very much, Colin and Chris. I'll go to a live question now. Tracy Anderson, you have your hand up. You can unmute yourself. The mic is yours.
Thanks, Claude. And thank you all for creating a space for us to have these discussions. I totally agree with that, Diane, in that it is a very, very anxious time, and we do need to find a way to be kind to each other and navigate through this. So we've talked about, protecting our privacy and how we're going to handle that. Another issue that sort of is in my mind is the idea of the equity across the workloads. What I mean by that is, with the return of some courses within different programs, sort of half online, half on campus, how are we going to deal with the inequity of, say, I am, happen to be scheduled to come onto campus to deliver some labs, while others with my same teaching load or a similar teaching load are doing it on campus. I happen to be, hypothetically speaking, if I happen to be one of those people who are not vaccinated for any number of reasons, I then am in the position of potentially being on leave without pay. How will the college approach that in terms of, I'm trying to find the best way to articulate my question. So we talked about the idea of looking at temporary vacant positions. How do we deal with the inequity of, okay, well, faculty member A happens to be fully vaccinated, but happened to be teaching that section and that content online, versus this week I'm being asked to teach on campus, and given my unvaccinated status, I'm at risk of losing my compensation.
Yeah, I recognize it. It does get complicated given the unique cases we may encounter and the number of permutations that are possible with the scenarios we've talked about. I'll have maybe Diane and Chris try to help with your question, Tracy.
Thanks.
Thanks, Tracy, for your question. So you're right. When we get into those overall, here's the scenarios, here's the guiding kind of principles that we are going to apply. And then we get into the nuances of accommodation and what does accommodation look like. So certainly if it's a bona fide medical accommodation and or human rights protected grounds accommodation, as we have in the past, and we always will continue to do, we look to other alternatives for the individual, whether it's a faculty, a support staff, or an administrator. And so we do have those options to play with. When it gets into a personal choice, I have to go back to, this is a requirement of the position then to now be on site. And so if the workload has been assigned that the position is required to be on site, from my perspective, it falls into those scenarios. If there is not the requirement, because there is the flexibility within assignments, that might be a little bit different. But again, if the assignment is required to be on site, then we fall into those scenarios. And it is unfortunate that it may provide then an inequity. But that's what we are currently dealing with in order to be able to get our fall up and running. Chris, I don't know, from a pedagogy or a workload assignment, if you have anything else to add.
No, you said it very well. It is complicated. It is, we certainly wish to be as fair and equitable as possible, but with classes starting next week, all but the last 2 or 3, and I'm making a number up, work assignments have already been made for the fall term, and not really intending to go back and rework all of those work assignments. So folks know right now what their work assignment is. Within that work assignment, if they're required to be on campus, that's when these scenarios come into play.
The only thing I will add is that the province is grappling with this, as you see in the media and in chatter that's happening in announcements from the province, the whole issue of what really qualifies as a bona fide reason is being obviously examined very closely, both for medical or for Ontario human rights protected grounds. And if you listen to Dr. Moore, those reasons are going to be shorter rather than longer. And there's going to be added clarity around this coming out very shortly. And I know there will be challenges that will take this into the legal realm. But in terms of trying to apply rules that are set out through legislation, through advice received by the province, by cabinet, from the medical community, they're trying to make this as simple as possible for people to understand and apply those procedures for us. So there might be, in a very few days or weeks, additional information coming out that helps clarify some of those reasons that would create exemptions that lead to accommodation or arrangements. But specifically around the equity piece, I think this is something we're going to continue to examine. It's not going to be 100% perfect. I realize that. We're living through a very volatile and uncertain situation. But as an employer with the values that we espouse, and we've said it, we're putting in place steps that will do our utmost to be in step with those values. Tracy, does that address your question?
Yeah, thanks, Claude. I think it begins to, as Diane said, and as you said as well, Claude, I think in the coming weeks, it will be something that we have to navigate.
Absolutely.
Yeah, it's not an easy process. Thank you.
Indeed. Thank you for your question, Tracy. Okay, I'll go to our next question in our Q&A. Hello. For general public that comes in to acquire services such as massage, etc., will they need to be fully vaccinated to visit the college? How will the general public prove their vaccination if needed? Okay, so this is not a student, not an employee. So Colin.
Yes, good question. In short, yes, they are required to show proof of vaccination. In our policy, we have given some language around who is covered by this policy and who may not be covered by this policy. Certainly, transient access to the college, someone who is a delivery person who's dropping something off at a receiving dock would not be covered. But clients coming into the college who are participating in services and who are mixing with college staff and students absolutely are part of the policy. In terms of the requirements for what they need to show to gain access to the college, I'll send out a link to our website, but there are alternatives. We will be accepting proof of hard copy proof of full vaccination at entrances for people who show up and were not aware of the requirements. They will be able to use hard copy proof. We are also accepting proof of 2 negative rapid antigen tests during the past 7 days, or also hard copy proof of a negative PCR test within the past 48 hours. So there are ways to gain access to the college without participating in the vaccine passport process. We've also recognized that there is a lot of activity in the vaccine passport business these days. You've heard that the province of Ontario is proceeding with something similar. The province of Quebec has launched their vaccine passport, and I understand some of the other provinces are as well. So we will recognize vaccine passports from other jurisdictions as well. With those, it's a little bit more involved. We need to be able to have the person clearly demonstrate that the passport reference to the required number of doses of approved vaccines. So, flashing a screen that has the province of BC logo on it and a code doesn't necessarily pass that test, we'd actually have the person stop and show us how, their vaccine passport correlates to two approved doses or two doses of approved vaccine. But certainly that would be acceptable.
And as a corollary to that, Colin, question asked is, can the proof be a PDF in an email or a photo on their phone for guests coming in?
Absolutely. And to that point, Claude, actually, I had a text from a technical person on my team to let me know to the earlier questions about PDFs.
Right.
PDFs can be submitted as well in the website, although they can't be submitted on the app. They can be submitted to the website address.
Okay, super. All right, thank you very much, Colin.
Okay.
Our next question comes from Laura Rogel-Black, and the question is, should students who do not intend to be vaccinated by choice be advised to withdraw from courses that have on-campus assessments after October 12th? Before I go to Chris on this, my advice would be, really, our role is to also educate and create promotion and awareness. And I think we need to do our utmost to encourage folks who by choice right now are choosing not to be vaccinated to understand the benefits of the vaccine for themselves, for their loved ones, and in the community at large. And I think that's the angle I would like us to follow here, is the advice we provide to learners, who is to continue to encourage them to receive their vaccination. Chris?
It's very well said, Claude. The first response, foremost response, is around education on the vaccines, on the benefits of becoming vaccinated. If a student does choose to remain unvaccinated, certainly if they go through the app, they will be sent to Student Support Services. There's a process to follow there. I know the Intercept program will also be having conversations with students. But in the end, if they choose to remain unvaccinated after October 12th, if they have required on-campus learning activities, they will not be able to participate in them. And so it would be very difficult for them to be successful in their education, should they choose to remain unvaccinated and have a program that has on-campus learning requirements. I do note that it's a very difficult decision, because Algonquin College is not alone. This is Ontario-wide post-secondary institutions have been mandated to have a required vaccine policy. And so if a student chooses to not attend Algonquin, they will be hard-pressed to find an Ontario post-secondary institution where they'll be able to continue their studies if it's required to be face-to-face. So these are all parts of the conversations, and I know that the folks in Student Support Services and the Intercept program will be having those conversations with students. It's all part of the education about the choice to become vaccinated or remain unvaccinated.
Okay, thank you very much, Chris. Our next question is, if your second vaccination document shows that you have received 2 doses, do you still need to upload documents for both your first and second shot? Good question. Colin, perhaps you can address this one.
Sure. The app is certainly designed to collect the information for both shots that are received, as well as the documentation for both shots that are received. In some cases, and we've seen some examples of errors that have been made where people's data entry doesn't necessarily reflect the photos that have been submitted. So if you make a mistake and enter AstraZeneca for your first shot and then submit your 2 shots documentation, we can see that, you made a mistake. Pfizer was your first shot. Then those mistakes we can overlook those mistakes because we have the 2 documents. If you make a mistake like that, and we only have 1 document, then that passport would be denied. So we do ask that both documents be uploaded to the app.
And we can provide the links to the Ontario provincial system that allows you to do that. And it's easy. You just need your health card and punch in your details, and it will spit out your request, either your first dose, your second dose, any of the certificates that you need will be on the provincial system, and it's easy to get access to those. Next question comes from Sofia de la Barra. What happens with students who have clinical lab courses to attend in the beginning of next week? Will their application have enough time to get approved before then, since it does take some time to be processed?
My short answer is yes. Now, keep in mind, if there are passports that are denied through this process, then that will create some delays for those students. However, we have a team of people working on getting through the approvals to avoid any unnecessary delays.
Okay, thank you. Next question is, will the college be charging a fee for testing? So I'm assuming we're talking rapid antigen testing here, because we do charge fees for some tests that people take in other circumstances. Okay, I'm kidding here. So for rapid antigen testing, the kits that we'll be getting, I believe, are free kits, and we are not allowed to charge a fee for something that we're receiving for free. So we would not be charging for those rapid antigen tests that we administer. But I will turn to Ben in case I am speaking in error here.
No, Claude, you're absolutely right. We do get them free from public health, so we're not able to charge for them when we distribute them here.
Okay, thank you for that. All right, our next question comes from Annette Nebuzi. Can you please provide details on what step the college has taken to safeguard our medical information submitted through the app? I believe that's a similar question to the one from Sean Pentecost earlier on. I'm not sure if there's a subtle nuance perhaps in this question. Colin, is there anything else you can shed light on for Annette's question?
I believe, at previous town halls, we've spoken to this. In terms of the technical protections, certainly the app developers have gone through our security and data privacy assessment with the assistance of our cybersecurity team at the college, and have gone through that more than once now, as we've used them for more than one application. And they're following best practices for the security of these documents. In addition, part of the certainly the thinking around privacy is that we don't want to be holding on to private documents any longer than is absolutely necessary. So built into the app is this feature that as soon as a document is viewed and approved, that document is immediately deleted. So we don't hang on to that information at all. The broader context for the question relates to, I think, the previous answer that was provided around discussing people's status as it relates to vaccination. And I believe the response was that we are going to provide some guidance around that for employees to just reiterate that there is no situation where it's right to, at an individual level, ask people about their personal health or where anyone should feel obligated to respond to those sorts of questions. So I think we'll come forward with some language around that for everyone's benefit.
Okay, thank you very much, Colin. Next question is, can you further explain the quote unquote cap on vacant positions portion? All right, so I'll turn this over to Diane.
Thanks, Claude, and thank you for this clarity question. So when I was referring to that, it was with regards to scenario 2 within personal arrangements in the slide. So let me just kind of set that context again. In that particular context, it is personal arrangement, so not a bona fide medical accommodation or one protected under human rights. It is unvaccinated by choice. And in that scenario, the employee had also advised that they will not be vaccinated. They will not participate in any of the safety protocols as determined by the college. And so personal choice, and also will not participate in any of the rapid testing, etc. And so what the college will do in good faith is to look to temporary vacant positions for the duration of the time period noted in the policy, which was up to October 12th, that we are allowing that kind of grace period where there's the rapid testing, etc. But after that time, the college will not look for a temporary vacant position term for an individual that falls within this two different conditions. Again, not vaccinated by choice and will not participate in any of the safety protocols. And then the search for an alternate vacant position for that individual will end on October 12th.
Okay, thank you very much, Diane. Next question is a short one. Is the vaccination policy temporary? The answer is yes. We'll only apply this policy as long as we have directive from public health and legislated by government to have such policy in place. Colin, anything else to expand on this? No, good, all right. Next question is, who decides what a bona fide human right protected ground decision? Can you provide an example, please? Not sure, Diane. I did say though earlier on that that's still being articulated within government and looking at regulations and policy, and so that there will be some fluidity, if you wish, with this in the near future. So I just want to caveat that. Diane? So with regards to who would decide, I'll speak to kind of the process more than an actual example of a protected ground. So again, the process, it gets identified within the attestation app by either an employee or a learner. That then is triggered to either student support services, to the director's office, or it gets triggered to human resources. So who decides? Depending if you're an employer, if you're an employee or a learner, it would go to one of those two places. Within human resources, it would go to wellness and abilities, and it would be assessed. We normally, I'm sure you've heard of us referring to Monroe Chappelle. They have transitioned their name. It's actually called LifeWorks now. And we would be working very closely with LifeWorks to ensure if it is a medical accommodation that is required, that we would be acting on that. From a bona fide human rights protected ground, an example of that would be creed or religious beliefs. And that also would be vetted within human resources. And if required, we would need to also potentially vet with legal counsel. And I believe that then you had referred to your process, and there was also that vetting perhaps with the ombudsperson, but I don't want to speak on your behalf. Perhaps you would like to jump in as well.
Sure. For any of the really difficult cases or where students appeal the decision, then we would bring in the Ombudsman's office and they would help us from a legal perspective and give us advice and guidance to help us and the students.
Okay, thank you very much, Diane and Ben. All right, next question comes from Tamara Alexander. Our program will be delivered in a fully face-to-face format this fall. A student in the program does not wish to be vaccinated for personal reason that will not meet the standard required for an exemption for vaccination. The student is asking for full refund of their fees. Normally, the student would not be able to receive the $500 tuition deposit back. However, given that the college has significantly changed the terms of attendance after the student enrolled in the fall semester, can consideration be given to providing the students with a full refund, including the $500 tuition deposit? Laura, would you like to take this question?
Absolutely. I read it earlier, saw it coming through. So I did put into the chat that yes, students up until day 10, which is September 20th, will receive if they're withdrawing for the with regards to the application of the vaccine policy, will get a full refund, including the $500. So that is up to September 20th, day 10. Anything after day 10, as per our standard policy, can go to an exemption process for refunds. And again, hopefully students will have ample time. We've been announcing, highly promoting awareness of the processes of the policy. So there should be ample time for students to fully understand and make decisions prior to September 20. So hopefully that answers your question, and I think the events team might be able to put something in chat with links for you there.
Okay, thank you very much, Laura. And we're mindful of that. We're mindful that the decisions that we are making, that the province is making, frankly, are late in the game in many respects. We've been working on our fall term plan, as I mentioned in my introduction. We have been talking about this with our students, getting excited about the return for the fall, the conditions under which we were going to offer our academic programming and our services, and now this. So we're mindful that this creates a different set of conditions, and some students may have to rethink what's in their best interest. And so with that in mind, we'll do our utmost to assist them and not create those undue financial hardship. I do want to stress, though, because I know the question did come up later on, and if someone is by choice saying, I'm not going to get vaccinated, I won't participate in the things you've put forward, but they say, okay, you're doing, we will accept an RA test, it's costing me, will you help me pay for this? And I don't qualify for a bona fide reason, we are not going to pay for those, okay? So just so that I'm clear, there is no financial support from the college anyway to support that for individuals. So just so we're clear. And with that, I know we have, as I said, more questions than we had the capability to answer this morning. We will take away the remaining questions. We may lump them together if they're like-minded and try to ask the same thing so that we don't have a list of 47 questions. We will take those away, we will answer them and post those on my AC in the days to come. Again, I want to really thank everyone who came this morning to listen, get informed about this vaccination policy, its implementation, and the processes associated with the app rollout and our decision tree. And for your really thoughtful question, I asked that we come in a good way this morning into our meeting, and you did just that. And I want to thank you for that. And with that, I will turn it over to Ron for a closing. Ron, over to you.
All right. Segu Agwegu, Digana Dasanengat's greetings, everyone. Before I offer that traditional closing, just to acknowledge the anxiety and the frustration and just the general sense of unknowing, right? We're in a really unique time, and as a community that taxes us in a really unique way. So I won't belabor the point, but we'll call upon our ancestors and all those who came before us and give thanks to them for everything they did to get us where we are today. Special acknowledgement of each of us, each of you, and all the commitment and investment that we need to continue to make so that we are able to make it through this challenging time also in a good way. And then all the investment, of course, that we make for those who have yet to come up. Ultimately, that's the reason we're here. And so we put our thank yous and our acknowledgements into those three places, squish them together and invest. And so while it is a unique time, I believe we can come and step up to that investment. So with that, thank you all for coming with a good mind and sharing in a good way, and we'll continue to invest this semester. Yamongo, Ganston Haladu, Guatnigu Hage, Danitum.